Hi, and welcome back to Kentucky Health Solutions YouTube channel. My name is Justin, and we're continuing our Medicare 101 or Getting to Know Medicare YouTube series. I believe this is the fourth installment in this series where we're going to start diving into enrollment. You see the first one up here behind me on the screen is the initial enrollment period. Let's go ahead and dive right into this. Feel free to like and subscribe to the channel. Helps us out and lets you know when we upload any new content, as we'll be uploading updates and other Medicare and health insurance content. So initial enrollment period. So this is the 3 months before, the month of, and the 3 months after your 65th birthday. So if you turn 65 on, May the 5th, you've got 3 months before that, the month of May, and 3 months after to get enrolled. If you're already receiving Social Security benefits, you'll be automatically enrolled in Part A and B, or after receiving disability for 24 months. You're usually automatically enrolled in both. If you're not receiving Social Security benefits, you'll have to enroll yourself by going to ssa.gov or calling or physically visiting your local office if they're open. Enroll early to avoid gaps in your coverage. So, for instance, if you're retiring and losing your group coverage at the end of April, you may want to start a month or two ahead of time to get your Medicare set up for a May start date if eligible. You can refuse or delay your enrollment in Part B. For example, let's say you're working past the age of 65 and have qualifying employer coverage, you can do that. And once you're enrolled in Part A and B, you can usually 3 months before your Medicare starts, you can start looking at the Medicare Advantage or prescription drug plans we've talked about previously. So just keep all that in mind. These are important. Feel free to pause the video if you want to take a look at any of these in a little bit more detail. So there is a Medicare supplement open enrollment period that kind of runs around the same time as these others. So if you're 65 and first getting Medicare or enrolling for Part B for the first time, so let's say you delayed your Part B because you were continuing to work, now you're feeling like you're wanting to retire. Once you get Part B for the first time, you have 6 months after that to enroll in a Medicare supplement with no underwriting, and you can enroll in a plan later, but you may be denied or charged more based on health history and underwriting. So again, it's important to know when your enrollment periods are and to make sure you're using them correctly. Special enrollment periods. So again, let's say we're working past 65. The month after the last month of employment or employee health coverage, you have 8 months to enroll in Parts A and B if you haven't already, and 2 months to enroll in Part C and D. So that's your Medicare Advantage and drug plans. So you can enroll in both, just part of the plan, or whatever else. So, and remember that enrolling in Part B will trigger that Medicare supplement open enrollment period where you get that guarantee. You want to go ahead and enroll in a Part D plan early to avoid any penalties, because remember, you get a penalty based on every month that you don't have it that you could have. Late enrollment premium penalties. So these just give you an idea of what they would look like. If you're Medicare Part A, none if qualified for premium free. If you don't qualify for the premium free, which remember, that's working 40 quarters or 10 years and paying your taxes for it. Otherwise, it's a 10% penalty per year. Medicare Part B, none if you qualify for the special enrollment period, such as qualifying employer coverage that you're leaving or something like that. Otherwise, it'll be 10% for each full 12-month period. So for a year, it's 10% for every single year that you don't enroll that you should have. Part D, there's none if it's less than 63 days without credible or qualifying coverage. Otherwise, it's 1% of the current average premium for each month. So you would take the average premium for 2022, which you can find on the Medicare website, multiply that by 1%, and then you apply that extra penalty on top of your regular premium for each month that you're not in a drug plan that you should have been. When can you change your coverage? So there's the Medicare annual enrollment period, which is October 15th through December 7th. So this is where you can make changes to your drug plans, Medicare Advantage plans, hop back and forth between options. Now, you may still have to answer health questions if you're going from Advantage to Medicare Supplement, Medicare to Medicare supplement if you didn't enroll at a correct time. So just keep that stuff in mind. And then there's one more called the Medicare Advantage Open Enrollment Period. So this is January 1st through March 31st, and it gives you one last chance to change your Medicare Advantage plan. So a lot of the time they reopen this because sometimes doctors will leave the network or retire, and maybe your new doctor won't be in the network of your current plan. This gives you one last chance to change that. So that's just one example, but any other reason you can change your plan if it's not turning out how you expect it, if let's say you made a change during the annual enrollment. And in that Medicare Advantage open enrollment period, if you have to have a Medicare Advantage plan, but you could go back to original Medicare with a Part D drug plan, or you could just switch to a different Advantage plan, just to clarify that a little bit. Special enrollment periods, so some qualifying events. Usually the special enrollment periods last for 2 months to enroll in a Part C or D drug plan when these events happen. So that could be moving out of your plan service area, moving into a new service area that has new plan options, even if it's generally the same area, because certain counties will have different plan options than others. If you leave or lose other healthcare coverage, you qualify for a special needs plan. That's where we were talking about earlier, certain chronic illnesses or what we call dual eligibility, Medicare and Medicaid can qualify you for those special needs plans. You move into or out of an institution, such as a nursing home. You get or lose financial help with Medicare, so that'd be like your low-income subsidy for drug plans or the Medicaid, or move back to the U.S. after living outside of the country. Those are a couple examples of those special enrollment periods. There can also be special enrollment periods due to weather or other things, like if you had that annual enrollment period, a major disaster comes through and you're not able to switch because obviously you have something more important on your mind at the time. Sometimes they give you extra special enrollment periods in the case of natural disasters. So that's really where we'll wrap up for these different enrollment periods that you can get into. A couple little extra things for Medicare that I wanted to point out to everybody is something called extra help. So there's 2 different ways to get extra help. You can go through Medicaid with your state usually, which can help pay for your Medicare Part A or B premiums, pay for deductibles, co-insurances, and qualify you for those special needs plans, potentially. Call them dual special needs when you have Medicare and a qualifying level of Medicaid. There's also extra help, which is done through the Social Security office, is how you apply, and that gets you what we call the low income subsidy for Part D prescription drug costs, which will help pay for premiums, deductible, and co-pays or co-insurance on your Part D drug plans. And one last thing that's new for 2021 and going forward now into 2022 where we're at is there are some lower out-of-pocket costs for certain insulins. So different companies will offer different plans. Some will participate in what we call the Part D Senior Savings Model, which is where rather than on the left there, you see the current enhanced plan. That was again for 2020 and back. Usually you're going to have to meet a deductible. You'll get into that coverage gap or donut hole that we talk about because insulin is not cheap. But with this new Part D Senior Savings Model, some insulin brands with companies are going to be just a $35 copay all the way through. Doesn't matter where you are in your drug plan's design. It'll be a $35 copay. So keep that in mind. Talk to your plan to see if they participate, if this is something that you're not taking advantage of, and always talk to your doctor before you make a change in your medications. So again, thanks for checking out the Kentucky Health Solutions YouTube channel. I appreciate your help and viewing and liking and subscribing, hopefully. And please come back. We're going to do one more video in this Medicare 101 series where we talk about options for if you retire early before you're eligible for Medicare. Thanks again. Remember to like and subscribe and have a great day.